The next speaker is Bechara Choucair. Bechara is the Commissioner of Public Health for the City of Chicago. He thinks we've asked him to come and talk about his current job. We've actually asked him to come and talk about Rahm Emanuel. But I suspect he will make few comments about the mayor. But his job is extraordinary. It's very exciting from minute to minute, because I think when he answers the email or answers the telephone, he's not quite sure what's going to be the query on the other end of either of those communications. Bechara.
Thank you. All right, thank you. Welcome, everyone. I know some of you are from Chicago, but I also know many of you are coming to visit the city and participate in this conference. And on behalf of the mayor, I want to welcome everyone, and I want to let you know that he made sure that we have a great weather this weekend. So while you're enjoying the conference, please make sure you enjoy what the city has to offer. Go out to our lakefront, enjoy our museums, our fine restaurants, our smoke-free environments, and make sure you make the most out of your visit to Chicago. I think we're seeing today more and more physicians transitioning from clinical settings to non-clinical settings. Some start in a clinical practice, then transition to non-clinical careers, and others go to non-clinical careers right from the get-go, from residency of medical schools. I'm actually one of those who practiced as a family physician for a while, and then slowly transitioned to becoming in a public policy environment. And what I want to talk about today is really three core beliefs that I developed as a practicing physician, and how those three core beliefs really are core to making Chicago the healthiest city in the nation. As a practicing physician, I quickly developed the understanding of how important it is access to care. So access to care is that first core belief. The next one is access to information, so that people can have access to making the right choices. So as we think about it from a public health perspective, it's those three core concepts: access to care, access to information, so our population can make the right choices, are key to making Chicago a healthier city. But I'm getting ahead of myself, so let me just talk a little bit about how I grew up. I grew up in Lebanon, in Beirut, Lebanon, in the midst of a civil war that took the lives of tens and tens of thousands of people, and hundreds of people got injured. And as we were fleeing from one part of the country to the next, we had to flee to other parts of the country, my parents were very focused on making sure that the whole family is safe, but also my sisters and I had access to education, never lost focus that we have to finish school, we have to go to college. Many of my friends ended up in militias, dropping schools and all of that. And really I realized how lucky we were as a family when I got to medical school. And I practiced as a third-year medical student. I was seeing patients in one of the clinics in Beirut that was providing services to the poorest of the poor. And we all have memories of one patient who really made a difference in our career. And to me, that patient is this one Druze woman. Druze is a small religious sect, mostly based out of Lebanon, but also out of Syria, Palestine, Jordan. And this woman came into the clinic, and she was dressed in this long black garb, and she was very, very quiet when I went to the exam room. She didn't have any eye contact, and I thought, well, it's probably cultural, and that's fine. And after a while, she said, I'd like to see a woman in the room. And I invited one of my colleagues, and she started telling us in whispering that she has noticed a mass in her private parts that's been growing for the last few months. And sure enough, after we've done all the testing and the exam, turned out that she had a vaginal mass, vaginal cancer. She ended up dying. And as I reflect on this one Druze woman, this woman did not have access to care. She did not have access to the right information, and she wasn't provided the right information to be able to make the right choices. So fast forward a few years, I finished medical school, and I wanted to be as far away from my family as possible. So I ended up in Houston, Texas, at Baylor College of Medicine, doing my family medicine residency. And in Houston, I practiced in a healthcare for the homeless setting in a community health center on the northwest side of the city that was providing services mostly to Mexican immigrants. And when I first moved to the United States, I was 24. I was in 97 with like 2 2 big bags with a lot of stuff that I don't really need, and maybe a couple of $1,000s in the bank. And I was so excited. I got there. I stayed at the hotel for the first night, and then I had somebody the following morning come in, get me in a car, go do the rounds in all the apartments possible in Houston. I had an apartment by the end of the day. I needed the phone. I had to call an 800 number free and get the phone installed the following day so I can still have my dial-up for the internet at the time. I needed a car. I always thought, oh, I'm going to have public transportation until I got to Texas, and I heard Houston is much better now. But I needed a car, and it was Saturday night, and I went to the dealership. Here's like this kid who's got the thickest accent possible with very little money, and I ended up leaving the dealership on Saturday night with a brand new Ford Explorer with no money down. And I got home and I said I had to get back to my phone and call my mother and tell her, you have no idea. It is just so amazing to live here. People have everything they need. It's so convenient. And I thought that this is going to be the same case when I started seeing patients, and I was in for a shocker. I remember many of my patients who were experiencing homelessness that we saw day in and day out, month after month, under the bridges or in soup kitchens or in shelters with the same problems. And I also remember one of my patients at one of the at my Northwest Side clinic that was 14 or 15, and she was pregnant. And I remember when I started seeing her, I was, bedazzled. Like, what am I going to ask her? And the first question that came out of my mind, where is your husband? And now, as I reflect back on that horrible, horrible questions that I've asked her, it just made me realize how important some of these issues that we deal with from a societal perspective, whether it's homelessness or teenage pregnancy. And I knew that we had to be thinking in better options. I know that the individuals that I was providing services to in Houston had problems with access to care, have problems with access to information, and they could not make the right choices because of those issues. So when I moved to Chicago, I wanted to be involved more in public policies. I spent some time working with people experiencing homelessness in Rockford, and then I joined an organization here in Chicago called Heartland Alliance that does a lot of human rights work. And then one day, Mayor Daley's office called, and they said, hey, would you be interested in the health commissioner's position? I've never met Mayor Daley before, and I was prepping for my interviews and all of that. Sure enough, a few weeks later, I was offered the job, and I could not miss on this opportunity. The opportunity to shape public policy when it comes to health and public health, and really be able to transform the health of our city. So I was very excited. I started the job there, and then sure enough, a few months later, the mayor decided not to run again. Now that I gave up a great job, I had to be basically starting to look for another job again. But sure enough, a few months later, Mayor Emanuel was elected, and he asked me to stay on board. And within the first 100 days of Mayor Emanuel's administration, we released a public health agenda for the city, Healthy Chicago. And in that agenda, we wanted to achieve 4 things. We wanted, 1, to identify our public health priorities for the city and make them public. The second thing, we wanted to set measurable targets for each one of those priorities that we'd want to achieve by 2016 and 2020, and also make those public. And then the third thing, which was very, very important, we wanted to identify the types of strategies we'd want to be investing in, whether it's policy, systems, or environmental change, to really make a difference and help us get those targets. And we wanted to make those public so that the public is holding us accountable on how we're investing the money that we invest in the public health system. And we wanted to figure out a better way to engage our traditional public health partners, but also our non-traditional public health partners. So when we thought about Healthy Chicago, we really looked at it as a most aggressive assault on disparities in our city. And we looked at how can we shape our efforts when it comes to access to care, access to information, and access to choices. When it comes to access to care, if you remember back in March of 2010, a few months after I was appointed, President Obama signed the Affordable Care Act into law. And here in Chicago, in the city of a little bit less than 3 million, we have 500,000 people who are uninsured. And we know that the Affordable Care Act is going to give us the opportunity to provide the majority of those folks with access to insurance and hopefully better access to care. So we have a big job to do. 500,000 people that we'd want to be able to reach out to. We can't do that ourselves as a government agency alone, but we have to partner with community-based organizations, community health workers, where people are going to doing job training, where people are going for education. These are the spots and these are the partners that we have to partner to ensure that these individuals have access to insurance. And I'm really excited that actually the Cook County area, the Cook County Health and Hospital System was able to get a waiver so we can start enrolling people in expanded Medicaid in January 2013 rather than having to wait till January 2014. So we are making good progress on enrolling people in insurance, and that policy change and all the programmatic aspects of it is really a core belief that's so critical that I've developed as a physician that I'm very using very regularly as a practitioner, as a public health official. The second bucket is access to choice. And the reason why this is important is a lot of time we think about how do we make our choices. And a lot of time when we go to vending machines, all we find is junk food. When we go to a beverage machine, all we find is sugary drinks. And we've made it a point that we wanted to transition what we're selling in our vending machines here in Chicago city buildings and the Chicago public schools, but also in the private sectors. We've challenged them to come along and join the mayor's challenge to transitioning what we're selling in our vending machines into healthier options. But we've also took the choice beyond that. We wanted to make sure that as people choose their mode of transportation, they have the option to have more bike lanes. So over the last year and a half, we've created 27 miles of protected bike lane in our city. 27 miles of protected bike lanes. And one of those bike lanes, protected bike lanes, is on a major street in the heart of the business district here in Chicago. If you're here for a few days, I encourage you to check it out in the central business district. We've also wanted to make sure that people have access to bike sharing. So we just launched actually a week ago, a new bike sharing program that makes available 3,000 bikes where people through 300 different stations where Chicagoans or visitors could hop on one of these bikes and use it for as long as they want and drop it at the next bike station throughout the city. We've also created more choices for our residents for physical activity. We've taken streets in some of the neighborhoods that have the least amount of green space or have the highest rates of violence and turned those streets into play streets. We block the streets on a regular basis, the same day of the week, for 3 to 4 hours, and kids and their parents could be out being physically active and engage in a lot of healthy activities. And what we've learned from those Play Streets events is that people are liking the fact that they feel safer in those neighborhoods, and that's part of why we're creating those choices. Teen pregnancy, and this is around access to information. Many of you might have seen those ads. We've launched this campaign a few weeks ago, and we wanted to make sure that teen pregnancy is an issue that we've raised to a point that's so important, and it's such an important public health issue for so many reasons. Teen moms are more likely to deliver babies prematurely. They're more likely to deliver babies with low birth weight, and the infant of teen moms are more likely to die in their first year. So for the baby, teen pregnancy is not really the best. But think about that for a moment. Less than 50% of teen moms will graduate from college. Less than 2% of teen moms will get a college degree by the age they're 30. Think about the economic and the social impact of this problem. The daughters of teen mom are 3 times more likely to be teen moms themselves, and the sons of teen moms are twice as likely to end up in jail. So when we think about such an important public health issue, and while we've seen a significant decline in our teen birth rate in Chicago, 33% over the last 11 years, great progress. The nation dropped at 22%, we dropped at 33%. But our rates are still higher than the national average, and we know that we could do better. So as part of the campaign to making sure that information is available for our residents, we've started this unexpected campaign. You don't expect to see a pregnant boy, but so are most teen pregnancies. And that's why we're talking about the importance of using protection, but also waiting. If you choose to wait, that's really a good option as well. So when we started this campaign, we thought that we're going to get some coverage locally, and we did. We launched a campaign in early May, and we got coverage in all TV outlets in Chicago. All papers talked about it. We were really excited about it because we wanted that to spark that conversation. And sure enough, we started seeing coverage in Missouri. We started seeing coverage in Iowa and Wisconsin. We started seeing coverage in DC, Philadelphia, New York. We started getting calls from Houston. We started getting calls from Dallas, San Francisco, LA. We started then all of a sudden having the same conversation about teen pregnancy happening in Colombia, Australia, Venezuela, London, Japan. I was, talking to a reporter in Japan one night. That's, kind of with the time difference. It was a lot of fun. And then all of a sudden, we started getting coverage over the last 72 hours. We got coverage on Good Morning America. We got coverage on Today's Show, on The View. And we started hearing, other good coverage that's been coming out of that. Not all of it positive. The overwhelming majority has been very, very positive. But what was important is sparking that conversation. So as we think about my patient, my Druze patient back in Lebanon, or the pregnant teenage girl back in Houston, I was so excited that I was able to give them some of the information, because I know that access to information is so important for making the right choices, for empowering people to make the right choices. And it's that same belief that I took from my patient care that's now right into our public policy work through the health department. So it's really difficult to transitioning the health of a city, but it's really important as we think about these three concepts. How do we take what we've learned as physicians, or what we've developed as physicians, and importance of access to care, importance of access to information, so you can make the right choices. If you take that set of skills and you implement it, or you incorporate it into your public policy work, you really can make a difference. And I really want to take this moment to encourage you to think about how you can be involved in public policy, how you are sitting around that table when these public policy decisions are being made, because you then can really continue to make a difference, and in a city like Chicago, continue to make an impact on almost 3 million lives. Thank you so much for being here, and enjoy Chicago.
Thanks, Bechara.